So let's start off with a few questions and then we'll get into the details of our case. So have a look at this question. All right, 10 seconds. Okay. Glycolysis generates ATP via which of the following? All right, the majority chose A, oxidative phosphorylation, and then even divide between B and C, which is substrate level phosphorylation and electron transport. So here the key word is glycolysis, right? Glycolysis, which is that first phase of glucose oxidation. And that is going to generate ATP by substrate level phosphorylation. Remember, we initially described two different ways to make ATP. So we described that oxidative phosphorylation was using oxygen. It was how we made the majority of ATP. This happened inside the mitochondria, right? This was via the electron transport chain. Whereas glycolysis generates ATP by substrate level phosphorylation. This is what we describe as borrowing a phosphate from another molecule. So it makes a small amount of ATP and it is happening in the cytosol here, and it doesn't require oxygen. So substrate level phosphorylation happens at glycolysis, and then oxidative phosphorylation happens in the electron transport chain. All right. Oops, sorry. Okay, so I accidentally revealed the answer there, but let's still have a look at this second question. All right, a few seconds left. Okay, so oxidative phosphorylation, which are the following, right? Majority of you went with A, generates 28 of the 32 ATP molecules made from a glucose molecule. And that is the correct response. Let's look at some of the distractors. So is the last step in the process only generating the last 4 ATP molecules? That's not true, right? We know glycolysis is what generates the 4 molecules, right, of the 32. And again, let me explain here. So the 32 to 38, that's a natural variation, a natural range. Some literature will say 32, some will say 38. And we talked about this earlier, that there can be difference in physiology, difference in age range, difference in ethnicity that will result in slightly different metabolic rates and different numbers of ATP. So 32 to 38 is the normal range, so to speak. And so when we say this 28 out of 32, we can also think about it being 34 out of the 38, which is what we just illustrated in our drawing. What I will test you on in your books is that 38 number, because that's what the majority of the literature has. And so a different response here would be 34 of the 38 ATP are going to be made from oxidative phosphorylation. Okay. Sends its products through the Krebs cycle, we know is not true. It actually receives the products from the Krebs cycle and then adds a phosphorus group to aid in energy storage, we know is also not true. Okay. All right. So just a bit of a recap as far as what we know to be true from glycolysis. Also, we want to recall what we just described, right? So across the inner mitochondrial membrane, we've got these complexes inserted in the membrane. We've got a high concentration of hydrogen ions on the outside, a lower concentration on the inside near the matrix. And what we're doing is we're bringing the electrons from glycolysis, etc. We're passing them from complex 1 to complex 3 to complex 4. And every time we pass these electrons, we move hydrogen ions actively against their gradient, right? Notice the arrows here are red, indicating that this is an active process, and it requires the energy that we liberate from moving those electrons. So we move hydrogen ions from low concentration to high concentration, and then we accumulate this large number of hydrogen ions in the intermembrane space. And in doing so, we can now move them passively. Again, notice the arrow on the ATP synthase is green. Down that ATP synthase, that is going to liberate energy now because we're moving molecules along their gradient, which is a passive movement, and that is going to give up energy. And we can harness that energy and phosphorylate 34 ATP to make much more ATP, okay? We also want to remember here that we've got oxygen standing by to be the final acceptor of these electrons, and that will just generate water. So the electrons with oxygen together will generate water, and then that water will be lost as a byproduct of generating ATP. Okay, so this is just recalling what we described as far as how we make ATP, why oxygen is involved, and how we utilize those electrons that we've accumulated. Okay. Let's look at a few teaser questions here before we get into the case. So why is the mitochondria called the powerhouse of the cell? And why do we need to breathe oxygen to live? We can think about the responses to that. Why do we call the mitochondria the powerhouse of the cell? And why do we need to have oxygen to live? Why is oxygen an important component compatible with life? Excellent, thank you. Yep, so mitochondria creates the energy for cell functions. Perfect, well said. So the mitochondria is pretty much the battery, right? Another response here produces a significant amount of ATP, and then we need oxygen to accomplish aerobic respiration, which is significantly more efficient than anaerobic respiration. Absolutely correct, absolutely. And again, very well said. So aerobic respiration is much more efficient, right? If we think about the numbers of ATP that are produced, aerobic respiration with oxygen as that electron acceptor produces a lot more ATP. Anaerobic respiration is not as efficient, all right? We're not making as much ATP, although we don't need oxygen, but it's not an efficient process. We'll talk about lactic acid, which is made as a byproduct of anaerobic respiration, and that's sort of the price to pay for making ATP in the absence of oxygen. Okay, so thanks for those responses, and those are correct. The mitochondria is the powerhouse of the cell. This is sort of the battery of the cell. This is what makes all the energy that drives the cellular processes. And again, it's the more efficient way of making a lot more ATP to help the cell make proteins, move things around, insert things into the membrane, cross-membrane transport. All of those things are generated with the energy that's needed in the ATP, in the mitochondria, excuse me. All right. Now, the case we're going to look at is called the Chicago Cyanide Murders. It's a case study basically highlighting the importance of oxygen as part of cellular respiration. And I'll give you somewhat of a backstory here. So I'm going to read this first part of the case, and then we'll talk about what's happening. So imagine that you're working at a medical examiner's office for a major metropolitan city. As a chief medical officer, you investigate suspicious deaths and provide toxicology services for the county. Unfortunately, it's been a very busy week. In the past 5 days, 7 people have died, all with similar symptoms. It is your job to examine the data and determine the cause of death for these victims. The first was a 12-year-old girl. Her parents said that she was awake in the middle of the night, complaining of a stuffy nose and sore throat. They gave her an extra strength Tylenol and sent her back to bed. At 7 a.m. the next morning, the parents discovered that the girl had collapsed on the bathroom floor. An ambulance rushed the girl to a nearby hospital where she was pronounced dead, right? That same day, paramedics found the second victim unconscious on his kitchen floor after what they thought was an apparent heart attack. Sadly, the victim's brother and fiance also collapsed later that night while the family gathered to mourn his passing. Both had taken Tylenol to help them cope with their loss shortly before collapsing, and neither survived. Now, in the next 4 days, 4 other similar deaths were reported, all in the same neighborhood and all with similar symptoms. Are these 7 deaths related? What is causing these people to die? It is your job to answer these questions before more deaths are reported, okay? Some of the reporting symptoms are dizziness, confusion, headache, shortness of breath or rapid breathing, and then vomiting, okay? So very suspicious circumstances, very suspicious events. And we're seeing sort of a trend of all of these patients having taken the same Tylenol, okay? So that's kind of the backstory that we are looking at here. Now, most of the deaths were very rapid, occurring within a few hours of these initial symptoms. Okay. All right, any questions on that first part? So we've got a series of deaths that seem somewhat related. They're in a similar neighborhood geographically. The patients all reported the same presenting symptoms: dizziness, confusion, headaches, and then they're all reporting that they have taken Tylenol. Okay. Let's look at part 2, what we see from the autopsy report. So the immediate cause of death was hypoxia, suffocation or lack of oxygen. Tissue sections from the heart, lung, kidney, and liver all show massive cell death, right? Meaning that there was a massive necrosis or death of the cells. Staining with specific dyes showed major mitochondrial damage within affected tissues. And then the oxygen levels in the patient's blood were approximately 110 millimeters of mercury, and the normal range is 75 to 100 millimeters of mercury. So, recalling your knowledge of the function of organelles, what function of cells was interrupted in these patients? And could this loss of function lead to the death that is seen in these individuals? Why or why not? All right.